Around $140,000. That was the cost of my hospital visit with the surgery that was required to save my life. Before you ask, that was with insurance. You may think this is an absurd amount of money, and it is. America needs a better healthcare system because the current one is not good enough. I stayed in the hospital for a month and a half. I required surgery to remove 1/3 of my intestine. I was given the choice of going to the hospital or getting surgery or dying. I am decently well versed in America's half-baked healthcare system because of this. To start, let's talk about the insane costs. America's healthcare system uses a classification system for your healthcare coverage called in-network and out-of-network. Essentially, what it means is that if a doctor accepts your medical insurance, you are considered in-network. If a doctor doesn't accept your medical insurance, then you are out-of-network. Though don't let that fool you. Even if your insurance is accepted and considered in-network, you can still end up paying a pretty penny because of how your individual insurance works. For example, I had medical insurance and the company was based in New York. While in New York, the costs weren't that high. A doctor's visit was around maybe $20 for copay, and that was about it. But when I moved down here into Florida, I ended up in the hospital. My insurance was accepted, and I was considered in network, but the insurance barely covered anything because it wasn't New York doctors that treated me. They decided that they weren't going to cover anything that was happening down here in Florida. In the article America's Healthcare Cost Crisis, Lifeword mentions how 13% of Americans know of someone that died because they could not afford medical treatment. That should not be the case for anyone. Speaking of the costs, you might be wondering what are the options for better healthcare. There are actually multiple options for healthcare reform. And they are not as bad as some people might say. In the article, Demystifying National Healthcare Reform Proposals, Bureauhouse mentions how instead of using Medicare for some, or how Medicare is now, we could do Medicare for all. With this reform, everyone would get Medicare and not just the current people that qualify, like the elderly. The other reform Bureauhouse mentions is a single payer system. With this system, the government is the only payer of healthcare services. This would eliminate private insurers, which would then decrease overall administration costs within hospitals or even doctors' offices. With both of these methods, though, your taxes would go up as a result because your insurance costs would come right out of your federal taxes from your paycheck. But the difference is that everyone would be covered. No more skipping a doctor visit or treatment and risking death simply because you cannot afford it. Which leads me to the last thing I want to talk about. Healthcare, in and of itself, is a human right. Like Chapman says in her article, Healthcare Reform, a Human Rights Approach, healthcare is first and foremost a social good. No one should have to worry about not being able to put food on the table because they had to get treatment for an illness. You should not have a fear when you go to the doctor's office, wondering if you can afford the visit or if you can pay your bills because of the doctor's visit. You shouldn't have to pick and choose treatments you need because of you lacking income. No one should fear seeking help. We have spent just a moment together talking about America's healthcare system and my views on it. America needs healthcare reform. The costs are astronomical. There are multiple options that you can look at to make it better. I only spoke of two. There are more. And it is a human right to be able to seek medical attention when you need it, instead of only when you can afford it. No one should have to choose between getting treatment for an ailment or dying like I was forced to. Thank you for listening.